Good afternoon, and thank you for joining us for the latest update on the 2019 novel coronavirus, or COVID-19. With me today is the Secretary of the Pennsylvania Department of Aging, Robert Torres, and he will talk about actions that the Commonwealth has taken to protect our senior community. Before we go into our daily data report, I have a special reminder from Pennsylvanians returning from countries with a Level 2 or Level 3 CDC travel advisory. You are to quarantine at home and monitor your symptoms. If you become sick, please call your healthcare provider for testing. Now, as of 12 a.m. this morning, we have 133 Pennsylvanians who have tested positive for COVID-19. All of these patients are either in isolation at home or they're being treated at hospitals. A county breakdown of cases is available on our website at health.pa.gov. As of 12 a.m. this morning, 1,187 patients have tested negative at either commercial laboratories, hospital laboratories, or our state lab. As this outbreak continues and testing increases, we are less able to specifically track all of these exposures. At this point, we can assume that there are people whose exposure we cannot trace back to a specific source. However, we are not yet seeing sustained community spread, as defined by the CDC. However, we do expect that sustained community spread will happen in Pennsylvania, which makes the social distancing measures that Governor Wolf has announced so essential to protect all Pennsylvanians. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch your face after touching a surface. And clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your health care provider. If you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. What is most important for Pennsylvanians to remember is to stay calm, stay home, and stay safe. Now, I'd like to turn things over to Secretary Torres.
Thank you. Good afternoon. I'm pleased to be able to join my colleague, Secretary Levine, today to talk about the steps the Department of Aging has taken to mitigate the impact of COVID-19 on Pennsylvania's older adults. Older adults, especially those with underlying medical conditions, are at higher risk of serious illness from this virus, and that is why the actions of the governor has taken are so important. First, I want to thank everyone in the network of aging providers, direct care workers, and community volunteers for all the work you've been doing to protect the safety and the well-being of older Pennsylvanians. Since the first case of COVID-19 was announced, the Department of Aging has reached out to our area agencies on aging, senior centers, and adult day centers to provide guidance, connect them with resources, receive input, and help meet their informational needs. In fact, we began weekly check-in meetings with them this past Monday, and will continue to have those meetings every week. We are further issuing guidance to minimize required face-to-face contacts between older adults and staff who support them, such as protective service workers and care managers. We know many older adults may be concerned about their medications, so I want to speak directly to older adults who are enrolled in our PACE pharmaceutical program. If you're worried about running low on your prescriptions, you do not need to wait until you have 75% of your medications used before you can get a refill. Our PACE program is working to ensure older adults remain in their residences and receive their prescriptions when they desire them. All enrollees should be able to receive free home delivery of their medications from their pharmacies. The PACE program is making an exception to their policy that requires enrollees to use 75% of their supply before refills will be reimbursed. However, this exception will not apply for opioids or other controlled substance. Those requests will be handled on a case-by-case basis. Enrollees wishing to receive an exception to the refill requirement must have their pharmacy provider contact PACE. Enrollees who have difficulties obtaining their refills can call cardholder services at 1-800-225-7223. The Department of Aging has released guidance for senior centers, adult day centers, and for aging services programs that provide home and community-based services, such as our options, domiciliary care, and caregiver support programs, to help minimize face-to-face requirements and to help streamline assessments that may be needed to provide services. We are also working to provide guidance related to protective services and our long-term care ombudsman functions, again, to minimize exposure to both the older adults and the staff that are responsible for these functions. This temporary guidance relaxes some requirements and provides flexibility to help meet the needs of older adults who use these services while ensuring their safety and the safety of the staff who interacts with them. As part of the Governor's declaration, senior centers have been closed. However, the area agencies on aging each have implemented contingency plans to address communicating about the closings and the service options available to senior center participants, providing essential nutrition service through other methods beyond congregate meals, making referrals to other community resources, and reaching out to isolated senior center participants. Pennsylvania is a great place for older adults with the variety of programs that we have funded by our lottery. Thousands of older adults take advantage of the opportunity to socialize at their local senior centers every day in our state. For many seniors who live alone, this interaction with friends is their only source of socialization, an outlet that for now would not be available. So, if you know an older adult who will be missing out on normal social engagement or who is isolated, I ask that you reach out to them by phone or video conferencing technologies like FaceTime. Understand how much a few minutes of your time means to older adults living alone. You can make a difference to reduce social isolation while practicing social distancing. Thank you.
Thank you, Secretary. And now we're available for any questions.
Thank you, Secretary Levine. The first question is from Jennifer Radel from WLVR Radio. Do Pennsylvania hospitals and healthcare providers have enough ventilators and hospital beds for the number of people projected to become ill? What's being done to prepare, and can the state get more ventilators?
So it's very important for us to be doing two things at the same time. At the first, we're working to mitigate the spread of COVID-19 in Pennsylvania. That's our strategy now in terms of the social distancing measures and the closures, the school closures, the restaurant, bar closures, and other business closures that have been announced throughout Pennsylvania. At the same time, though, we need to prepare for the possible and, in fact, likely surge of ill patients over the next number of weeks from COVID-19. So we have reached out to all of our stakeholders and partners in this effort. We're working very closely with our county and municipal health department partners. We're working with the Hospital Association. We're working with healthcare and health systems and their hospitals directly to make sure that they are prepared for this consequence. We are working with them on several different fronts. One is in terms of making sure that they are setting up testing sites for patients, if at all possible, in their area. Second is to make sure that they have excess bed capacity to be able to deal with this surge. We have waived a number of regulations that they would otherwise have to notify the Department of Health that they were increasing beds. We're going to be working with them on those options. And then we're also working in terms of personal protective equipment and ventilators. The Pennsylvania Department of Health does have a store of ventilators, but in the case that even those are exhausted, we're working on other ways to obtain ventilators for hospitals and health systems in Pennsylvania.
Secretary, this next question is from Cody Carlson from Erie News Now. Have any patients who have tested positive for coronavirus in Pennsylvania fully recovered yet?
So I don't have that specific information at this time. We also don't talk about specific patients. But I can tell you is that the definition of recovery has changed. The previous CDC definition is that someone had to test twice negative for the virus. That has been shown in some of the first states to sometimes take a long time, which means that they're isolated for perhaps weeks and weeks and weeks, which can be really difficult. And so the new criteria from the CDC has been established, and we're working with that new criteria, and at the same time to protect the public health. So it's a balance.
And as a follow-up to that, WTAE in Pittsburgh would like to know how long after exposure will a person test positive for the virus? Will a person test positive throughout the entire incubation period?
So the incubation period can run from 2 days to 14 days with an average of approximately 5 days. And we don't exactly know if someone will test positive for the virus and at what time they will test positive in relation to when they develop symptoms. We are working on the data that shows that the vast majority of patients will test positive when they start to develop symptoms. And again, that's 2 to 14 days with an average of 5 days.
Secretary, we're getting a lot of questions about commercial lab testing and if there will be a published list of commercial labs that are doing the testing and if we're overseeing the integrity of those outside tests in any way.
So the commercial laboratories that are doing testing right now include Quest and LabCorp. But other testing labs are coming online, and we can certainly announce that when they're available. But also hospitals and health systems are developing their own tests. Specifically, I know that Children's Hospital of Philadelphia has developed a test. The Hospital of the University of Pennsylvania has developed a test, and UPMC has developed a test, and Allegheny Health Network has developed a test. So they are all developing their own tests. In the past, all of those, and really actually right now as well, all of those laboratories have been supervised and approved for their testing by the FDA.
This is a question from Ed Albert from Fox 43. During a measles outbreak, a patient's recent locations were released. Why is the same not being done for COVID-19?
The reason is that measles is actually a much more contagious illness. There are two things that we're watching really carefully: how contagious an illness is, and then how severe it can be, and how many patients would pass away from an illness. And COVID-19 is very contagious. It's more contagious than the flu, but it is much less than actually the illness that has the most people who can be affected by one person, and that is measles. But however, more people get sick and die from COVID-19 than of measles. So because of that, of the contagiousness of the measles virus, which is unlike any other, we would announce the locations.
This is from David Wenner from Penn Live. Given today's jump of about 30 cases, how does that look in terms of exponential spread?
So at this time, we are seeing that exponential curve in terms of new cases. That is being seen globally. That is being seen in the United States, and that is being seen in Pennsylvania. And you are noting correctly the steep rise of new cases that we are seeing. What we're working on, as I mentioned, are two things at the same time. One is the strong mitigation efforts, the assertive mitigation efforts with social distancing announced by the governor, but also preparing with hospitals and health systems and healthcare providers for the potential and likely surge of patients over the next number of weeks.
ABC 27 in Harrisburg would like to know, what is substantial community spread, and how many cases in the state so far are community spread?
Well, so we're actually not going to be able to really know now because in terms of the exact number of cases that might be community spread. Because of the number of cases, it's not possible to do specific contact tracing on every single case. We will see if there's sustained community spread, which is a significant number of patients for which we have no idea how they have obtained it, and we will get an idea from our county municipal health department partners and our own efforts about that, but we're not going to know each single case in terms of contact tracing.
This is from the Pittsburgh Business Times. Can you talk about what preparations are being made for excess bed capacity, not just in terms of hospitals and existing spaces they own, but also non-traditional sites, mobile hospitals, unused buildings in the community, hotels, event spaces? Mm-hmm. To what level do you think there will be a need for non-traditional hospital space?
I would expect that there will be a need for some novel and creative ideas about non-traditional space. I don't have specifics at this time. We're considering all alternatives and are working with the hospitals and health systems themselves about their ideas of what would be best to be able to decompress hospitals. So we're actually going to be working with them in terms of their ideas and then working out what the solutions will be.
And Ford Turner from the Morning Call has a similar question, this one focused on Montgomery County.
I don't have the specifics in Montgomery County. We will, of course, be working really closely with Dr. Akush, the head of the county commissioners in Montgomery County, as well as the Montgomery County Health Department in terms of what their surge capacity will need to be, as well as the excellent hospitals in Montgomery County. So this will need to be a collaboration between the state as well as local government and local health departments.
We have several outlets asking about testing capability, about expectations of testing capability to increase for the point where anyone with symptoms can receive a test, not just those who traveled or deemed at risk. Mm-hmm. Is there a concern that untested individuals are going to continue to be adding to the spread? Well,
we are working to increase our testing capacity significantly. So it has only been just over 2 weeks. 2 weeks and 2 days that the Pennsylvania Department of Health was able to do any testing in terms of the challenges that the FDA, that the CDC experienced. And so more than 2 weeks ago, all lab tests went to Atlanta. We started testing, again, 2 weeks and 2 days ago with 5 tests a day, and then several days later up to 25 tests a day. Now our lab can do well over 100 tests a day. But one of the game changers was the addition of those commercial laboratories and health system laboratories. And so really we're prioritizing our tests for those who have some specific exposures, maybe a concern about a cluster, extremely ill patients, and we're really recommending that people go to their healthcare providers, their hospital health systems, calling ahead to make sure that they're prepared to do testing through the commercial laboratories and those health system laboratories. So anyone who has symptoms related to COVID-19 can see their healthcare provider and get tested through LabCorp, through Quest, or perhaps through the hospital. They don't all have to come. In fact, they're not all going to come to us. In addition, we have discussed over the last day or so a new initiative working in collaboration with the Philadelphia County Health Department and the Montgomery County Health Department on the federal initiative to do mass testing. I don't have details about that in terms of the timetable, et cetera. Those county health departments have lead, but we, Pennsylvania Department of Health and PEMA are backing them up in collaboration with the federal government to perhaps be able to do thousands of tests.
Secretary Torres, this question is for you. Several outlets want to know if you have specific advice for families who have seniors as part of their family or in their community.
I would encourage them to stay home. I've received reports that some seniors are out and about, for example, getting tax preparation services. The IRS has extended that deadline 90 days, so again, those services are not essential at this time, and I would encourage family members just to practice social distancing and follow the guidelines that have been provided by Department of Health and other sources.
And another follow-up question, Secretary Torres, do you recommend that seniors visit grocery stores and pharmacies, or are there alternative means that they should be getting their medication and food?
Well, most pharmacies have ramped up delivery services, so I would take advantage of those. Again, I think the objective here, especially for older adults with underlying medical conditions, is to try to remain as safe as possible, so I would limit going out, if at all possible. If there are individuals that can support seniors in that manner, I would encourage them to do that, reach out and see what support they can lend to older adults who may be alone and need that level of support.
Thank you so much. Those are the questions that we have today. If we were not able to answer your questions, we will follow up with you from either the Governor's press office or from the Department of Health's press office. Thank you. Our next briefing will be scheduled for tomorrow.
Thank you very much.
Thank you.